Welcome to the Tobacco Online Policy Seminar. Thank you for joining us today. I'm Daniel Cho, a PhD candidate at the University of North Carolina at Chapel Hill, studying health and tobacco use. TOPS is organized by Mike Pascoe and University of Missouri, Seshang at the Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hartman Boyce at University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available along with presentation slides on the TOPS website, tobaccopolicy.org. I will turn the presentation over to today's moderator, Michael Darden from Johns Hopkins University, to introduce our speaker.
Thanks, Daniel. Today we'll continue our winter 2025 season with a single paper presentation by John Kingsbury entitled The Effects of State-Level Flavored Electronic Cigarette Restrictions on Adult Tobacco Use Using Multi-Level Modeling, Findings from PATH Study Waves 5 and 7, 2018 to 2023. The presentation was selected via a competitive review process by submission through the TOPS website. John Kingsbury is an epidemiology program manager who works with the National Institute on Drug Abuse. John helps administer the Population Assessment on Tobacco and Health PATH study and helps disseminate study findings. Prior to working with NIDA, John worked at the Minnesota Department of Health as a research scientist for 10 years, where he designed and evaluated public health interventions, particularly on statewide tobacco prevention and control. John completed a postdoctoral fellowship in cancer prevention at the Harvard School of Public Health and received his PhD in social and health psychology from Dartmouth College. Dr. Heather Kimmel, a program official at NIDA and the director of the PATH study at NIH, is a co-author of the study and will answer questions in the Q&A. Dr. Kingsbury, thank you for presenting for us today.
Thanks so much, Michael. Let's see here. Okay, is that showing as expected?
That looks great. Thanks.
Perfect. All right. Well, thank you, everyone. Yeah, thank you, Michael, for the introduction, and thank you, everyone, for joining. Today, I am going to be talking about state-level flavored e-cigarette policies and the effect that they have on adult tobacco use. But before I dive too deeply into that, first, I want to share my disclosures for both myself and collaborators. So the sale of e-cigarettes increased 47% in US retail outlets from 2019 to 2023, with flavor categories like fruit, candy, mint, menthol, and desserts accounting for more than 80% of those sales. Flavored tobacco products have historically been marketed to youth and young adults, leading to high flavored tobacco use in these age groups. A recent study of young people found that 92% of 40 to 20-year-olds with past 30-day e-cigarette use reported flavored use. While flavors are commonly associated with youth and young adult tobacco use, the use of flavors is highly prevalent even among older adults. A nationally representative survey of US adults, so those age 18 plus, found that among those with current e-cigarette use, 77.3% used flavors. So that's what we see on the right-hand side there. You can see that even among those who are on the right-hand side, the older age groups, they're still using flavored e-cigarettes quite a bit. Flavors play an important role in the use of e-cigarettes among both young people and adults, but patterns of e-cigarette use, flavor preferences, and reasons for use do differ by age. For example, adolescents and young adults report a stronger preference for fruit and candy flavors, whereas older adults, so those aged 25 plus, have stronger preferences for tobacco and mint or menthol flavors. Relatedly, many older adults use tobacco or menthol flavored e-cigarettes in an attempt to quit combustible cigarettes. Young adults are more likely to try e-cigarettes out of curiosity and to perceive sweet and candy flavored e-cigarettes as less harmful than tobacco flavored e-cigarettes. Given these different use patterns, preferences, and reasons for using flavored e-cigarettes, restrictions on the sale of flavored e-cigarettes may yield different behavioral responses from different age groups. Furthermore, previous research suggests that flavored policies might impact youth and young adults more due to more experimental use patterns, and because their age makes them more susceptible to alter their trajectory of e-cigarette use.
John, I'm sorry to interrupt really quickly.
Oh, yeah.
Can you turn your camera on?
Yes. Here, let me.
There
we go.
All set. Thanks.
All right, perfect. Okay, so so the younger age group makes them a little bit more susceptible to alter their trajectory of e-cigarette use. So maybe transitioning from experimental use to established use, or experimental use to no use. And conversely, adults may be less impacted because they are likely to continue to use in order to quit other tobacco products. Okay, taking a quick pause here, want to do a poll question. So which of the following is not an e-cigarette or e-juice flavor? So bacon, Bubba's pig sap, roast chicken, Thanksgiving stuffing, Beetlejuice, tuna, or unicorn vomit. So which one is not an e-juice flavor? All right. I'm not seeing results come in. I'm sure if I should or not, but
I'm seeing it. I can tell you
okay.
that tuna is well in the lead here. You've got 57% with tuna. The next highest category would be roast chicken at 12%.
Okay.
So,
There we go.
oh, you see it now? Great.
Yes, I see it now. Perfect.
Okay.
Okay, I'll maybe give just a couple more seconds. 3, 2, 1. All right. So yeah, tuna, the runaway winner. So you are incorrect. The correct answer here is Thanksgiving stuffing. So that was, yeah, it was kind of an even distribution. All of those sound disgusting to me, but but yeah, only Thanksgiving stuffing is the one that's not an actual flavor. So, and kind of a funnier, actually, maybe a sad story, I think, when I was trying to come up with this question, tried to conjure up a fake flavor and did this, a couple weeks ago. So it was coming off of the Thanksgiving holiday. So maybe stuffing was on the mind. And when I did a quick Google search to see if it was in fact a flavor, the AI response was something to the effect of, no, this isn't an e-cigarette flavor, but here are all of if you want to make a do-it-your-own flavor of Thanksgiving stuffing e-juice, here's how to do it. Here are the spices you need. Here's step-by-step how to create this do-it-yourself Thanksgiving stuffing e-juice flavor at home. So found that a little disconcerting, but I guess that's, one of the many things that the internet might be used for. So anyways, there are a lot of available e-cigarette, e-juice flavors out there. And to help counteract some of these, many local and state policies restricting the sale of flavored e-cigarettes have been adopted in recent years to help address gaps in federal regulation. As of December 31st, 2024, 412 U.S. jurisdictions had implemented some type of restriction on flavored tobacco sales in an effort to reduce their appeal and to reduce the health risk of e-cigarettes, so nicotine addiction, and potential subsequent use of conventional cigarettes. These restrictions typically target either all flavored tobacco products or focus solely on e-cigarettes and either comprehensively restrict all flavors or accept menthol. A review of studies through May of 2020 found moderate to high evidence of an association between implementation of a flavored tobacco policy, predominantly at the local level, and reduced availability, marketing, sales, and decreased youth use of flavored tobacco products. More recent studies of state-level policies have found that youth and young adults exposed to flavor restrictions have lower odds of any tobacco use and flavored tobacco use, and that state-level flavored e-cigarette restrictions are associated with reduced e-cigarette sales. One of the questions that kind of remains in the literature is, are there unintended consequences of flavored e-cigarette policies? So while research to date generally indicates that policies restricting the sale of flavored tobacco products are associated with reduced sales and use of flavored products, some evaluations of these policies have detected unintended consequences. So for example, evidence from previous studies suggests that in response to flavored tobacco policies, those living in areas affected by the policy may alter their method of purchasing. So they may purchase online or from cities or states that are unaffected by the policy. Or they may switch to a combustible product if the flavored e-cigarettes are removed from the market. Conversely, a study of adults who reported using e-cigarettes to quit smoking found no association between duration of smoking abstinence and preference for non-tobacco flavored e-cigarettes. Additional research is needed to determine how tobacco use patterns change in response to flavored e-cigarette policies, and if there are potential secondary effects of these policies, such as switching to tobacco products that are unaffected by those policies. So taken together, current evaluations of flavored e-cigarette policies suggest that these policies may reduce e-cigarette use among young people, and that e-cigarette sales decrease post-implementation. However, past research on flavored tobacco policies have largely utilized cross-sectional designs and focused almost exclusively on youth, which limits our understanding of how flavored e-cig policies change tobacco use behavior of adults over time and from pre to post policy implementation. And also how different demographic factors such as age might influence responses to these policies. The current study aimed to address these limitations using a pre-test, post-test, non-equivalent groups design to assess the impact of flavored e-cigarette policies over time among adults aged 21 plus. So the specific research questions for this study were, what effect do state-level flavored e-cigarette policies have on e-cigarette use among adults? Do flavored e-cigarette policies have differential effects for different age groups? And are flavored e-cigarette policies associated with increased use of non-e-cigarette products? We examined these research questions using data from the PATH study, which is an ongoing nationally representative longitudinal cohort study of tobacco use and health in the United States. It was launched in 2011 to inform FDA's regulatory acts under the Family Smoking and Prevention and Tobacco Control Act. There were over 40,000 respondents in the last wave of data collection that has been released, which is wave 7, and we're currently collecting wave 8.5 data. For more information, you can scan the QR code that appears there, and I'll post this QR code at the end of the presentation as well. The current study focused on adults who were age 21 plus at wave 5. Data collection dates were December 2018 to November 2019 for wave 5, and January of 2022 to April 2023 for wave 7. Wave 6 data were not included in the current study because we are interested in policy effects on established behaviors versus behaviors that may be a short-term response to the new policy environment, such as consuming stockpiled products that are no longer available. Those younger than age 21 at wave 5 were excluded because the federal tobacco 21 policy, which prohibited retailers from selling tobacco to those age 20 and younger, was implemented in December of 2019 after wave 5 data collection had completed. So all analyses were weighted, but the unweighted N was 17,121 after eliminating those who did not participate in wave 5 and wave 7, were less than age 21 at wave 5, and who did not have complete data for all study variables. The primary outcome was wave 7 e-cigarette use, and we measured it in two ways: past 30-day use, which was defined as having used at least once in the past 30 days, and established use, which was defined as ever using e-cigarettes fairly regularly and currently using some days or every day. Flavored e-cigarette use was not examined as a separate outcome because all respondents who used e-cigarettes used flavored e-cigarettes. Current use of any tobacco product other than e-cigarettes was defined as having reported past 30-day use of at least one of the following products: cigarettes, little cigars or cigarillos, traditional cigars, filtered cigars, smokeless tobacco, pipe, snus, and hookah. The primary predictor was living in a state that had implemented a flavored e-cigarette policy between wave 5, which was the last past study data collection prior to implementation of state flavored e-cigarette policies, and wave 7 data collection. States were included if they had implemented policies that prohibited the sale of flavored tobacco entirely or restricted the sale of flavored e-cigarettes to tobacco specialty shops between November of 2019 and June 2020. Policies that exempted menthol were included in the current study. There were 6 states that met these criteria, and they were Maryland, Massachusetts, New Jersey, New York, Rhode Island, and Utah. Covariates were age, sex, race, ethnicity, education, and living in a state with an e-cigarette tax, and living in a state with comprehensive clean indoor air laws prior to wave 7 data collection. And these state policy variables were included as covariates, given their association with tobacco use. So we used 2-level hierarchical logistic regression models to assess change in odds of e-cigarette use and use of tobacco products other than e-cigarettes in relation to between-person exposure to flavored e-cigarette policies. Our primary focus was on how within-person change in use over time, so from pre-policy to post-policy implementation, differed across individuals who experienced flavored e-cigarette policies relative to individuals who did not experience these policies, which is similar to a difference in difference approach. First, we examined the cross-level interaction for time and policy for those age 21 plus, adjusting for the aforementioned covariates. And next, because use of flavored e-cigarettes varies by age, these same models were stratified by age group based on developmental stages. So we did it from 21 to 24, 25 to 29, 30 to 39, and those age 40 plus was the last age group. In addition to test for evidence of switching from e-cigarette use to use of tobacco products not affected by the policy, we examined whether the association between the time by policy interaction and e-cigarette use depended on changes in tobacco use other than e-cigarette status from wave 5 to wave 7 and wave 5 tobacco use other than e-cigarettes. All analyses were conducted using Stata, and all analyses used BRR replication methods, and the weights accounted for attrition and ensured representativeness. So I'll get into some of the results next, but wanted to take a quick pause to see if there are any questions.
Thanks, John. We're going to turn it over to our discussant, who is Dr. Daniel Dench, an assistant professor from the School of Economics at Georgia Tech. He's worked in tobacco research since his time at RTI in 2011, just following his undergraduate degree at Temple University. So, Dr. Dench.
So it's great to be here. Thanks for the invite to Tufts. I just want to say, I want to preface that I'm coming from an economist perspective, so maybe my questions about methodology will, I think I'm just trying to make the translation from the public health standpoint that you're coming from to like the language that we use in economics. And I thought that it was helpful to compare it to a difference in difference model. But before I get into more of the methodology details, I do want to ask the question, I guess for people who aren't aware of the flavored policy space, they might have heard that there was a national flavored policy, but we know people who have worked in the flavor space understand the distinction. I was just wondering, from your perspective, if you could give more insight into what the difference is between these state policies, state flavored tobacco policies are, and the national level policies. I think it would be helpful for the audience.
Yeah, so if I'm kind of tracking your question, at the national level, as of now, the restrictions are on flavored cigarettes. So you're not able to purchase, a grape flavored cigarette, for example, conventional cigarette. But so that's kind of at the national level. At this, some states have the ability to take things a step further and apply, those flavored restrictions to other tobacco products, with e-cigarettes kind of being the most common, and obviously what we're talking about here. So it was those 6 states that implemented flavored restrictions. So basically, folks who live in those states are not able to purchase e-cigarettes that are flavored anything other than tobacco flavored, which is technically not counted as a flavor per se. So yeah, the fruit flavors, the dessert flavors, if you're in one of those 6 states, you're not able to go to the convenience store or a tobacco specialty shop and purchase those sorts of products. And as I'm catching myself, so there are actually some, I forget which ones, I think 1 or 2 of those states do actually prohibit the sale of those products in a convenience store, a gas station, places like that. But you can actually purchase them if you go to the tobacco specialty shop. So, you need to be, I believe, 21 plus to enter those establishments. Anyways, so it's kind of basically trying to keep them out of kids' hands, is kind of the ultimate goal. So, yeah, does that help?
No, definitely. And I think my confusion, I guess, was coming in because I think like during the last Trump administration, like towards the end in 2020, they did try to at least ban flavored e-cigarettes, except for menthol. And maybe I think the distinction is that like there's no enforcement mechanism coming from the FDA's policy on bans, whereas in the states, my understanding, at least from when I looked at this, was that it's much more, they have much more stringent requirements for their sales and actual enforcement mechanisms. Is that your understanding as well, John? Or
Yeah, I think it's in terms of in practice, yeah, it's not really different unless the states take that extra step, to implement their own policy. So right, yeah, regardless of there being a federal.
Yeah, so Laura Bach is saying that the Trump policy only applied to cartridge-based e-liquids and not to all bans. So I think that's the distinction. Yeah.
Gotcha.
Okay.
Sure.
And so moving on to the more specifics about the model. So you use a hierarchical model. It's not that common in the applied economics literature to use a hierarchical model, but you did compare it to a difference in difference model. So I did want to like ask you sort of like, in the economics literature, we understand the standard assumption behind the diff and diff model to be that the treatment group would have continued trending like the control group if not for the treatment group. And that's like what we can say, like what our estimates, we take them to be as causal. Is there a similar underlying assumption in your model, or is there a different assumption, I guess is my question.
No, I think it's the kind of the same sort of assumption. It's, I kind of talk about it in sense of like a natural experiment, where there's all these people who are kind of similarly not exposed, and then a subset of that, total population is exposed to this intervention with, in this case being the flavored e-cigarette policies at some states, whereas all the others are not exposed. So kind of that's our intervention point where they're kind of going down one path or the other in terms of their exposure, and then measure the outcomes after after that intervention.
And just because like I'm sort of interested in understanding more about these models, what is the key like advantage over using something like OLS or simple time and person fixed effects that we would use in a difference in difference model in the same context?
Yeah, so full disclosure, my statistician is not here, so I didn't run these models myself. Might be a slightly more rudimentary understanding of it. But basically, it's kind of able to measure at two different levels. So you have folks who are experiencing these things, the intervention at a different, they're either exposed to that intervention or not. But then those individuals are kind of nested within states. So there may be things at the state level that differ, across those groups. And you want to be able to account for those differences across state. So it's kind of both tapping into things both within the state level and then also kind of the between state level. So kind of the mixed, that's one of the more of the advantages of the mixed model, I guess.
Okay. Well, I'm eager to see the results. I'm sure everyone else is. So those are my questions for now.
Thanks. Just before you get started, again, I just want to make a reminder to everyone to please put questions in the Q&A box and not the chat. We do have a couple good questions though in the Q&A. And so let me just ask you, when you think about the weighting that you use, so the PATH study is nationally representative, but not state representative. So how do you address the fact that the sample within a state is not representative of the state?
So it's a good question. So with the PATH data, right, it is nationally representative. We are not able to look at what we couldn't do here is, if they're, for example, like Massachusetts is one state that prohibited sale of all flavored products, all flavored tobacco products entirely. So e-cigarettes, hookah, everything. So not only e-cigarettes. We could not isolate Massachusetts and compare Massachusetts to all of the other states because we don't have representative data for Massachusetts. But if we're grouping states that have something in common together, then that's allows us to make those comparisons where it's like some characteristics of these group of states together compared to everyone else. So right. So because it is representative at the national level, if we take kind of a sample of states that have something in common and make those comparisons, that's more acceptable.
Do you adjust for the wave 5 differences in the treated states versus the untreated states?
The covariates would help account for those things. So like there's those couple there's those couple state level policies, so the comprehensive clean indoor air and then e-cigarette taxes. So those are all controlled for.
Can you just so one last question before we move on? Can you just help us a little bit with the literature? So can you maybe place your findings in the larger literature on flavor bans, which there've been a lot of papers on.
Yeah. I think a lot of the existing literature has utilized cross-sectional studies. I think in general they're in alignment or in I guess I haven't gotten to my results yet, but the suggestive of that these policies do have kind of the predicted effect that they're leading to less use, certainly among youth and young adults. So I think there's general support for these policies. I think where this study kind of takes things a step further, it focuses a little bit more heavily on adults. So I think a lot of the impetus for implementing these policies is to help reduce youth use or youth access to these products. There's less of a focus on what's going on with adults. So that's kind of the gap, I guess, that we're hoping to fill.
Great. So let's get to the results then. Thanks a lot.
Yeah. All right. So first, we'll start with some selected sample characteristics. So at wave 5, the mean age was 48.4. In terms of those exposed to a comprehensive clean indoor air policy in their state, it was 57.6%. Just under half lived in a state with an e-cigarette tax of 49.5%. In terms of flavored e-cigarette policy exposure at the state level, 11.6%. Past 30-day e-cigarette use at wave 5 was 8% and 7.1% at wave 7. Established e-cigarette use was 4.3% at wave 5 and 4.7% at wave 7. And past 30-day tobacco use other than e-cigarettes was 24.6% at wave 5 and down to 20.7% at wave 7. So first, for past 30-day e-cigarettes, e-cigarette use, models stratified by age group revealed a significant time by flavored e-cigarette policy interaction, predicting past 30-day e-cigarette use for those aged 21 to 24, with an adjusted odds ratio of 0.59, indicating a significant decrease among those aged 21 to 24 in past 30-day e-cigarette use from wave 5 to wave 7. So basically that, we see the interaction in that age group, but then the interactions for all the other age groups were non-significant. The figure here demonstrates this kind of visually, the interaction that we saw. So we see the significant decrease from wave 5 to wave 7 in past 30-day e-cigarette use. So demonstrated by that blue bar. And that's for those who are exposed to the flavored e-cigarette policy. Whereas the orange bar, showing a little bit of a flatter relationship from wave 5 to wave 7 past 30-day e-cigarette use among those aged 21 to 24. Next, for established e-cigarette use, the models stratified by age reveal the time by policy interaction predicting established e-cigarette use for those aged 25 to 29 with an adjusted odds ratio of 0.32, indicating a significant decrease in odds of established e-cigarette use from wave 5 to wave 7 for those who were 25 to 29 and lived in a state that implemented an e-cigarette policy. And again, interactions for the other age groups were non-significant here. And the visual depiction of this interaction, so the blue bar here, those who were exposed to flavored e-cigarette policy, and we see a reduction from wave 5 to wave 7 in established e-cigarette use, whereas for those who were not exposed to the policy actually appeared to increase from wave 5 to wave 7. Our analysis examining the effects of flavored e-cigarette policies on tobacco use other than e-cigarettes over time revealed significant effects of time. So main effect there, indicating less non-e-cigarette use in wave 7 compared to wave 5. However, there was no significant time by policy interaction overall or for any age subgroup, indicating that implementation of flavored e-cigarette policies is not associated with an increase in tobacco use other than e-cigarettes. So we can do a quick pause and see if there are any additional questions.
Dr. Dench, would you like to make any comments about these results?
Yeah, so first, these are really interesting results. The first question I have about them is, if we take these at face value, and I want to make sure I understand the results correctly, does it imply that that sort of e-cigarettes are not a gateway to cigarettes? In other words, if you have a lot of people who are quitting e-cigarettes, does it imply that then, and you don't have a lot of people taking up cigarettes, does that imply that e-cigarette users who quit would not then transfer over to tobacco use? Or are you thinking about it more along the lines of these e-cigarette policies don't cause people to become addicted to cigarettes to begin with. And I just wanted to see if you have looked into the distinction between those two possibilities and what's generating the results that you find.
Yeah, I think it's important to remember the context of the age group that we're measuring. So uh, a lot of individuals who are using e-cigarettes or who are addicted to e-cigarettes will have started before, prior, they're younger than our age sample here, or the population that we're looking at. So I think there is some evidence that e-cigarette use kind of predicts subsequent conventional tobacco or conventional cigarette use, but it's typically among younger populations. So here we were interested in kind of acknowledging that history is in place. Now we're kind of looking, okay, at this older age group, they're 21 plus, are these policies associated with, less use? So we can't really, it wasn't exactly initiation, but kind of like, is there less recent use of it? And then, the established use measure are able to kind of say, okay, is it, for folks who have used at least some point fairly regularly in their lifetime, is there any change in use of these products? So I think, I guess just kind of keeping in context that a lot of use or initiation of these products probably already happened. So we're not really picking up on that as much. It's kind of, okay, once we get to this older age group, what effect are these policies having on kind of early use and then established use of the products?
Yeah, I was just wondering maybe if, like, given that PATH is a longitudinal survey, the richest information you get is actually like the changes in the patterns of use across waves. And so I was wondering if you thought about taking, for example, people who are e-cigarette users in wave 5 and limiting the analysis to e-cig users in wave 5, or conversely, if you thought about limiting the sample to non-e-cig users in wave 5 and looking at the results for those people across waves. I do agree with you that the people who are in this age group, 21 to 24, probably have likely already initiated before 18, which makes the results even more interesting to me, because it implies that, for example, if most of the results are coming from people who are already initiated into e-cig use and they don't then start using cigarettes, it sort of implies that the narrative around e-cig use as a gateway to cigarettes that we've heard a number of times in the public health literature doesn't hold as much. And I think you can get closer to that question by limiting the wave 5 use. I guess that's more of a comment than a question, but I'd be interested to hear your thoughts about maybe pursuing that direction here.
No, I think it is an interesting point, and I think a lot of the work that did show that there was sort of that showed or supported e-cigarettes as sort of a gateway to conventional cigarette use was done many years ago, kind of in the early days of e-cigarettes when they weren't really delivering as much of a nicotine hit, I guess. So they weren't as efficient or as effective. So, people weren't going to be going from conventional cigarettes to e-cigarettes and being satisfied from a nicotine standpoint. But as the devices evolved, the e-cigarettes got to be better at that specific aspect. So I think there's a little bit less of the relationship, I think, is less strong there. So I think it's an interesting point. I would have to go back and double check our analyses to your point about, focusing on just those who are reporting use versus not. I would have to go back and double check and talk with my statistician, but I think we did run those analyses, and I think we basically opted to go with kind of this more full picture, including everyone. But anyways, I agree. I think it's a good point, something to consider.
The other major question I have after seeing the results is, like, I think the path does provide some information actually about like the flavors that e-cig users are using. And so I thought it might be interesting to like sort of bring out some of the mechanisms that are happening here. Like in particular, Wave 5 users that are using these flavors, like how many of them are dropping out versus finding an alternative path to using these flavors, right? And so you can sort of think about like 3 states where, they switch to e-cigarette flavors that are not banned. They could continue using the banned flavors, or they could stop using e-cigarettes altogether. I was wondering if you guys thought about using that information on flavors that's in the path at all, and why you maybe ruled it out for this analysis.
Yeah, I think part of it is getting down to sample sizes, especially given if we're only talking about 6 states, and then a behavior that's only being done by some small percentage, relatively small percentage of the population, and then dividing further, getting at which flavors, kind of. So I think that's part of it. We love path just because generally speaking, you are starting with a pretty big N, but it does get small pretty quick, I guess. We're talking about kind of only 11% of the population was exposed, and then kind of cutting it up a couple more steps from there. So, and I think even there, related to that, looking at others' demographic characteristic too is something of interest. But again, we kind of just ran into roadblocks of small sample sizes, so prohibited some of those interesting questions that we, I think thought were valuable, but we're unable to answer with this.
That's fair. I'm always sympathetic to power concerns.
Sure.
That's my last question.
Thanks, Dan. Yeah, so your co-author Heather is doing some heroic work in the chat. I just wanted to summarize a couple high-level comments that have come through, or comments that have come through. One is there seems to be really strong demand to break other tobacco use into combustible versus non-combustible, and try to understand those substitutions patterns a little bit more. Dan talked about it in his comments about this kind of gateway effect, and there being a lot of concern about that. It seems like your results are pushing another direction, so there's an opportunity here. And the second question that really emerged from the discussion in the chat was just that the big advantage of path is the longitudinal nature of it, and so the ability to see e-cigarette users in Wave 5 or even previously to Wave 5 is really powerful. One comment actually suggested that you look at dual users of combustible and e-cigarettes in 5, and look at substitution patterns and the effects for that subpopulation, because dual use is a particular policy concern. I guess those are both comments, but that's kind of what the discussion has been in the chat. And so, yeah, I'll let you comment on that, or go back to your presentation.
Yeah, no, I think the idea of looking at those who report dual use is an interesting one, because yeah, certainly it's a fairly common phenomenon. And then there's these policies that come into play that only affect only one of those substances that they're using, but not directly the other one. So right, like where do they go from there? Yeah, I know we did not look at that, but I do think that would be an interesting and potential kind of next step that this work could take. Okay, so let me move on to kind of the discussion and key takeaways. So the results here indicate that flavored e-cigarette policies were associated with less past 30-day e-cigarette use among those aged 21 to 24, and less established use among those aged 25 to 29. And this work suggests that flavored e-cigarette policies may play an important role in stopping young people from initiating e-cigarette use and in stopping older young adults from progressing to more established use. And flavored e-cigarette policies do not appear to impact the e-cigarette use of older adults, so those aged 30 and up. This may be because older adults are more apt to use tobacco-flavored e-cigarettes, products that are unaffected by flavored e-cigarette policies, as they may be using these products in an attempt to quit combustible cigarettes. Conversely, young adults have stronger preferences for candy and fruit-flavored e-cigarettes, so it is plausible that the policies prohibiting these flavors were sufficient to discourage e-cigarette initiation. There was no evidence of a corresponding increase in use of other tobacco products for those exposed to flavored e-cig policies for any age group, suggesting that these policies did not encourage people to initiate use of tobacco products that were unaffected by the policy or to switch to other products. The study findings have implications for public policy and tobacco regulation. But flavored e-cigarette policies have different effects for adults depending on age subgroup. They highlight the need for additional strategies to support older adults who use e-cigarettes to reduce use or to quit tobacco completely. Local flavored e-cigarette policies have been associated with some secondary effects, such as increased sales for tobacco products in neighboring jurisdictions, or tobacco industry pivot to similar but legal product names. So things with a concept name such as Island Breeze or Yummy Bear. We found no evidence of a corresponding increase in use of other tobacco products for those exposed to flavored e-cigarette policies for any age group. And while it's possible that individuals initially responded to the policy by trying other products, outcomes from this study were measured 1.5 to 3.5 years post-policy implementation, suggesting that any short-term switching of tobacco products had stopped by the time the study outcomes were measured. The current study highlights age as an important demographic to consider when implementing flavored e-cigarette policies, but additional research is needed to evaluate the equity implications for other demographic characteristics, such as race, ethnicity, and income. E-cigarette use in general is more common among adults with lower income, so it's possible that these policies would help reduce that disparity, but additional research is needed to test this hypothesis. So I would like to thank my co-authors, which are on the left-hand side here. Also Westat, who helps support administration of the PASS study, and my other NIDA colleagues. And here's that QR code again.
Thanks so much, John. One quick question from the chat. Just thinking about this DIY use, which I had not considered before, but it seems like it, at least with AI, that's something that is possible. Is there any evidence that do you have any evidence on DIY use to begin with? And thinking about how DIY use might be one of these kind of unintended consequences of these restrictions. And is there any evidence on DIY use by age?
Yeah, that's a good question. He's right. It's, I think there's probably a lot of different ways in which people could respond to these policies, and creating your own, especially if the internet is going to tell you exactly how to make it. I think that's something that that very well people might be doing. We do collect data on how do you get the products that you're using. For e-cigarettes, I would have to go back and look. I mean, I know there's kind of the response options that you'd expect, social sources, from a store, from a friend. I bought it, or took it. Like, I think we captured, did they take it from somewhere? I'd have to double check if there is kind of a create your own, a do it yourself sort of option there. For conventional tobacco products, we do capture, roll your own use, but I don't know to what depth we capture, kind of that for e-cigarette use. What that does make me think of a little bit is the EVALI outbreak, a few years ago, is where, it's kind of in someone's basement, selling all of these, kind of these cartridges and with was it vitamin E acetate, I think was kind of the substance that was causing all these issues for folks. So I think, yeah, I mean, I think it is something that people are doing, and I wouldn't be surprised if that is one way in which they responded to, which some people responded to the policy. I'm not sure if we'd be picking up on it so much in wave 7. They would have to, given that it's, as we mentioned in kind of that one of those last couple of slides, we collected the outcomes at 1.5 to 3.5 years after the policy went into effect. So they would have had to kind of establish their kind of do it yourself, kind of method of creating it, and been doing it for multiple years, basically, for us to pick up on that. So, but yeah, I think that is, probably something that some people did.
One question that popped up, generally thinking about the opposite of what you're studying, which is substitution from combustible to e-cigarettes. And so, that's something I guess you could look at with the PATH study to see if those who are smoking cigarettes in wave 5 were less likely to substitute towards e-cigarettes in wave 7, to the extent that they prefer flavored e-cigarettes in that process. So someone suggests that former combustible smokers actually prefer to substitute towards flavored e-cigarettes. Just get your thought on that.
Yeah, that is an interesting thought. So the idea would be that there would be less cigarette cessation in states that, yeah. I don't think we looked at that specifically, but yeah, it's certainly worth testing, and would be an important research question, because certainly in terms of thinking of things from the protection of public health standard, we're wanting to push people along that continuum of risk toward the lower risk products, right? And if we find these policies are inhibiting that in any way, that's not a good option. But I would just, my hypothesis is that would not be the case. But there are other options available. The tobacco flavored e-cigarettes are still out there, and yeah. But I think it's worth taking a closer look at that.
One other question that's come up: are you considering the controlling for any kind of state level cannabis policy during this period?
Yeah, I think that's a good question. It's actually some of the work that we're looking into now is kind of looking more closely at cannabis policies and how those may affect tobacco use. So we didn't examine it here in this study, but I think that is something that there are some studies out there in the literature that are suggestive of some those behaviors tend to cluster together, right? So cannabis use and tobacco, and you can throw alcohol in there as well. Not all of the studies aren't consistent in terms of finding effects of clustering of those behaviors, at least in terms of how people respond to policies that have been implemented at state level, so recreational cannabis legalization. But there are some that do suggest that there are effects on tobacco use for states that have implemented recreational cannabis. So yeah, we didn't control for it here, but I think that's something that's worth that we could have looked into. But yeah, as I mentioned, we are that's one of the next steps for some of this work is taking a look at the recreational cannabis policies and what effects should they have on some of these other substances.
And can you just give us like a quick kind of forecast, maybe, or some implication for states that are kind of considering these bans now that have not yet implemented them? Do your results say anything for them?
Yeah, I think they, with anything, with any policy, you're probably not going to hit all populations or all subgroups of the population. So what we found here was that, there were some effects in the, I guess, desired direction, the public health positive direction for those younger age groups, the young adults and the slightly older young adults. But for those 30 plus, there wasn't really any, any significant effects. So yeah, I came from my job before this was in State Department of Health. So with any implementation of a policy, you always want to kind of one, try to have a tailored approach, and two, offer additional resources for those who might not, respond to the policy. So in this case, for those age 30 plus, what can we do to help, kind of push them further along that continuum of risk toward no tobacco at all, and I think there's, there's other work being done in that space, to how do we help people quit entirely. There's certainly a lot more being done, how to help people quit combustible tobacco. There's less being done on how do you have adults who use e-cigarettes quit tobacco completely. So kind of there's a little bit from my knowledge, there's a bit of a gap there to get people kind of all the way to the end of that continuum. So I think that's one important piece and one area that we could look into a little bit deeper, and just providing resources to folks that maybe these policies aren't going to have as great of an impact on. So.
Great. Well, thanks so much for the presentation and your paper and your work. I'm going to kick it back to Daniel Cho to take us out. So thank you.
We are out of time. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of 174 people for your participation. Have a top-notch weekend.